I'm going to record this. Sorry, here we are. Catching up. As we go through this, it sounds like there might be some people not muted.
You can also mute everybody.
So as we go through this, there's going to be a lot of different information. So don't try to memorize all of it. If anybody wants a copy of the PowerPoint, just go ahead and you can email me. I have some cards up here, but it's Carter at TherAplay, and I can email you guys the slides to kind of read through later. So yeah, sit back and relax. And then just try to take in the general concepts because it's going to be so specific to each child. Each family, each situation is so different that it's going to be very unique to each person. And then also, I'm going to go ahead and start at the very beginning to kind of discuss the steps of getting a device, and then we'll kind of deep dive more into the different types of devices that there are. So our objectives of today are to define what AAC is, and like I said, how to obtain a device, and then discuss the different types of AAC, so going from high tech to medium tech to low tech, as well as discussing the high tech applications, devices, companies, and accessories. So there's a lot that goes with the high tech. And then why it's helpful, why AAC is helpful, and who it's beneficial for. And then discuss some misconceptions of AAC, and then how to integrate it into our daily lives. So what is AAC? The American Speech-Language Hearing Association defines it in two different areas. One is augmentative, so that means to add to somebody's speech. And I love that there's this piece because you do not need to be nonverbal to benefit from AAC. AAC is very, very beneficial for every child. And let's say they are verbal. Oftentimes I do run around the clinic with a device for our kids that are verbal, and we'll discuss more why later. But the augmentative piece is to add to someone's already verbal speech. The second piece of AAC is alternative. So if a child is nonverbal, we utilize a device to help them communicate instead of speaking. So going through the high tech to low tech. So high tech, as we can see on the table here, we have a variety of high tech devices that we'll go through more specifically. And then we go down to medium tech, which is more like buttons and communication systems like this, or icons like this would be more of the low tech. So we can go through from high to low. And then also in low tech, another piece that sometimes gets misplaced or forgotten about is even gestures, facial expressions, writing, or drawing can be spoken of as AAC. So even use of sign language, use of, especially with some of our older folks that have had a stroke, utilizing drawing can really help them too. So which method is best? Really, it depends is the answer, right? It depends on a child's motoric ability, their language and cognitive levels. A huge piece is patient and family environmental needs, educational environment, and then what does a child respond to best? So we have to take into consideration all of these pieces to identify what piece of equipment, whether it's low tech, mid tech, high tech, is best for the child. And it can take, multiple weeks, sometimes even a couple months to figure out the right fit. So then once we do find that right fit, what are those steps to obtain an AAC device? So first step is completing the AAC evaluation. As I had mentioned, it can take multiple sessions to identify what is the best fit for a child and their family. Once a device has been selected, then an evaluation report will be written up by your speech-language pathologist, and then get all the extra documentation that might be needed for insurance. And then depending on what device is selected, you also may need more documentation for you to fill out to get some specifications, like what color would you like and what type of voice does your child want to have on their device and things like that. And then there's also more documentation for your physician to fill out, as well as if your child is receiving OTPT, for them also to fill out. So a lot of different pieces of information. And once all of that documentation is completed and compiled, it gets sent off to insurance and for their hopeful approval. And if it doesn't get approved right away, there is an appeals process to go through as well. So kind of going now into the specifications of different technology that we can use, starting with high tech. These are just kind of snapshots of what high tech looks like. Over here we have Via Pro. Here we have one of our nice Toby's, and then up here we see an iPad. So these are just kind of little snapshots. So I kind of want to talk a little bit about the difference between a program and a device. So sometimes these can get interchanged, sometimes they can get a little bit confused. So when I think of a program, I think of anything like an application on your phone. So whether it's a Facebook or Instagram or your text message application, that is the program. The device is your phone that it's on. So some of the examples of high-tech programs are LAMP, Snap, Touch Chat. These things might be, or maybe your child uses one of them. And then some of the devices would be the Via Pro, which is built by PRC Saltillo. Tobii Dynavox has an i13. So these are all different examples of the devices. And you'll see here, these are a variety of devices that I'll go through a bit more. So these are pictures of the different programs. So over here, we have LAMP Words for Life. We have Touch Chat here, Go Talk Now, Snap, and Pro to Go. Some of them are, I've seen all of these. I've worked with all of these. I would say LAMP, Touch Chat, and Snap are the ones I've seen most on a lot of kids' devices. And then once again, here are the examples of devices themselves. So those were the programs. These are the actual pieces of equipment. We have the Via Pro, which is by PRC Saltillo. I do have a couple PRC Saltillo here. These are from Easter Seals. They're loaner devices, and I wanted just to show you different devices. This is an Accent 1000, and then this is also their eye gaze that PRC puts out. These are a little bit more bulkier of devices. I don't necessarily recommend these so much for a pediatric population, but I just kind of wanted to show you what they kind of look like. But the Via Pro is a little bit more user-friendly. It kind of is more like our iPad a little bit. And then the Tobii, we have a Tobii in person here. This is their eye gaze.
I think if you just hit the power button, it should just turn on the top. It should just pop on.
Let's see.
You may have to hold it first. There you go.
There we go. So, and this has their Snap program on it. So we can kind of see what it looks like. And so you can see the eye gaze picks it up here. And so this is, Tobii is really known for their eye gaze system, which is really awesome. Okay. And like I had mentioned before, these are you've heard me say PRC Saltillo and Tobii. These are kind of our main players when it comes to high-tech devices. Those are our big companies. There's also Talk to Me Technologies, and there's a lot of companies out there. There's a lot of options, but I wanted to kind of show you that some of the top ones that kind of get thrown around, if you know, to make you a little bit more familiar. So moving on to medium tech devices. These are just some examples. We have the Go Talk here, which is if you press the button, it'll say the name of what's on the icon. And you can see over here, you can pull these little sheets out and you can put in a new sheet. So let's say either bath time routine, bedtime routine, food, whatever it might be. That is an option. And then you can just re-record as you put in a new slot. The buttons here, these are really great for making choices. If your child is at that choice making stage. I like how they have the icons there. It's really important, I believe, to have a visual or a symbol to pair with the sound, because then it becomes kind of abstract. I don't know, like the blue button, is it going to say bubbles this time, or is it going to say banana this time? I don't know. So that's why it's really great to have the icon there. And then also we have the layered system here where it can go from a field of 1, if you can see it here, 1 picture, all the way up to, I believe it goes up to 16. So that's kind of this that we have here. So those are more medium tech devices. And then our low tech, we have, I don't know if anybody's heard of PECS, it's Picture Exchange Communication System. That is icon based. So pretty much what you do is a child will take the icons off the book, put them on the sentence strip. So you could pick off I1 and then bubbles, put them on the sentence strip, hand it to whoever you're communicating, and they would touch I1 bubbles. And so I kind of have icons here. It's not a complete text system, but a child could select from a field of however many icons you wanted to select their activity. As I had mentioned before, other options for low tech are drawing and spelling out or writing or things like that. Typically, I don't necessarily recommend these for children that are developing language. These are more systems in place for people that have had language and then have lost it. So what do we do when we can't communicate with our hands? What do we do when we can't access a device with our hands? There's really, really cool options that are out there. One of my favorite that I've been learning more about and exploring more are the neuronodes. And so what these are their little nodes, more or less, that you can wear on your wrist like a bracelet. You could put them on different areas of your body for muscle activation. And pretty much what the nodes do is they sense that muscle movement and they create a switch on your device. So another really cool thing about these is that it can sense whether it's a purposeful, meaningful movement or if it's a movement that you can't control. It actually starts to learn your body, which is pretty cool. So I'm actually going to be meeting with their rep for that next week. So I'll be learning more about that. So if that's something that you guys would like to know more about in the coming weeks, let me know. And as I learn more, I'll let you know.
We have
Yes.
a question in the chat, so
Yes.
sorry to interrupt, but I'm worried if we go too far, we'll never know the answer. It was, oh no, I've lost my chat. The question is, what's the middle 3-button device called? And I think that goes back to your screen that had the three buttons.
Options. You know what? I don't know the specific name of it,
Okay.
but I can find out, and whoever asked the question, I can give them this.
Thank you.
Another option outside of the neural nodes are eye gaze, which is a wonderful option. And so we have 2 different examples here of the eye gaze. This one, as I mentioned, is by Toby. This one here is by Paris Saltillo. And it's what it sounds like. You're selecting icons via looking at the screen. It's a little bit more challenging than it looks. It's really hard and it's fatiguing for the eyes. So making sure that we give that wait time and also intermittent breaks during the eye gaze. Another option are the switch buttons for other body parts. So we have a button here that you can put on a wheelchair. You can have it hit with your hand, your foot, your knee, your elbow, your side of your head, wherever a child can move it, however they can manipulate, they can access this button and it will be able to move your screen to select whatever icon you would like. There's also sip and puff, which is you sip into or puff into a little straw and it will also activate your device. So there's multiple different ways. These are just a few. There's even more ways to access a device if you're not able to utilize your phones. So the big question is who benefits from AAC use? And every child can do so. So the question is which method of AAC and then to what extent are we integrating it into their daily lives? So an example would be, we can go to the first. Oh, don't worry. Okay, my Spanish is not great. And if you know Spanish, you guys get extra points. But I want you to kind of listen to this sentence and see if you can figure out what it means. So, quiero comer una galleta y también beber la leche. So we'll go to the next slide and I want you to hear that sentence again. Quiero comer una galleta y también beber la leche. So before we had no idea really at all probably what that meant. But now when we're seeing icons, we can kind of guess, well, maybe it's something about cookies, eating a cookie, and maybe something about milk, right? So we're getting some type of idea of what that language means. And the same thing, for example, when we're sitting in a lecture, whether it's in high school, whether it's here today, whether it's wherever it might be. Let's say you're in there and the teacher is not giving you any PowerPoint, no book, you can't write down notes, you don't get any examples, no movement, no nothing. Try to learn that information in a silo and then think about how challenging that would be. The same thing with language learning. The more that we can create a multisensory approach to teaching our children language, the more that they'll be able to intake it more. So when we're looking at a device, when we touch the icon, we're seeing the picture, we're feeling the device, we're hearing that feedback, and we're able to not only hear cookie, but see, touch, and feedback, and then the immediate reward of cookie. Because I can't go in there to a child's mouth and put their vocal cords together and make them say something, but I can gently guide their hand to select a button. So it kind of helps with that immediate cause effect as well. So if there's one thing that you take away from today's presentation, it would be this, that AAC does not inhibit speech production or language development. That's one of our biggest misconceptions of utilization of AAC. But kind of as I had just mentioned, right, we learn as humans from a multisensory approaches, right? We don't learn in a vacuum, we don't learn in a silo. So, so AAC can help each child. And then also there is an article that I've included on the next slide that kind of dives in a little bit into the research. And I kind of underlined the kind of big takeaways. So this is a systematic review, which means they take all these different research articles and then they come up with a, well, so what do all of these different research experiments or papers say? And so what they found is that AAC interventions do not impede speech production. In fact, most studies reported an increase in speech production. And then our conclusions down here are that AAC interventions do not appear to impede speech production and may result in increased speech production. The modest gains observed require realistic expectations among clinicians and other stakeholders, such as families, teachers, and so on. So our kind of big takeaway is that it's not going to do any harm, and it may give us a more opportunity or more chance of being a verbal communicator. So other misconceptions is a child needs to be a certain age or cognition level, or that AAC is a last-ditch effort for communication. And you can click like 3 times because it's for effect. But the thing is, every child can benefit. So we learn cause effect, we learn our language, we learn all of these things via the tool of AAC. So let's say a child has a device. Now what do we do? That's kind of, we've gone through the evaluation, we've identified what system works best for your child. Now, what do I do with this item? So, so we kind of want to look through our steps to language development when we're looking at use of a device. So the first part is attention and listening skills, social interaction, play skills. And so cause effect really falls into these categories right here. So over here, I have some cause effect toys. So this is the real MVP of speech therapy, is the bubble machine. So I have a little switch button here. You'll see there's Velcro on it. So if we want to just do cause effect, press the button, and our bubbles go. In my face. And then if we want to add a language component to it, we can put the icon of bubbles on here. So they see the icon of bubbles, they hit it, and the bubbles will come out. Another step that we can look at to make it even more in terms of that communication, pairing it is bubbles. So let's say this is on in front of a child, and then I would turn the bubble machine on. Another fun switch that we have is this guy here. So let's say pushing down is hard for a child motorically. They can, this is also a lot more exciting than a button. Pull down on the ball and the bubbles will come out. We also have over here a little fish scene that makes some music that can be connected to a switch as well. So I have a little video here of one kiddo utilizing the bubble machine and showing that learning of cause effect. Hold it down, buddy. Hold it down. Get that whole hand. There you go. So that excitement of utilization of cause effect, that if I press this button, something happens. And like I had mentioned, to add like a linguistic component to it, we could put an icon on there, or we could use a button to show that this is what I'm requesting as bubbles. So, the next step to language development is our understanding of language. So that's helping a child understand what the icons mean or what a device, how it can be used for that communication. So for our next slide, we have to model, and model. So it's really, really big. Is that incorporation of the device in a variety of different activities. So whether that's during mealtime, modeling what food we're eating, or whether be careful at bath time, but it's a fun time. Maybe you hold it far away from the tub, but showing that you're playing in the bathroom, the water, you have bubbles, or maybe during a bedtime routine, get your pajamas on and just modeling that through. So on the next slide here, I have a video that shows modeling with book reading. Apple juice to go with it. Oh my goodness, he has the juice. Juice. He is, you can't hear it, but it's instant. What is he doing? He is drinking juice. So this is also a really fun example of that. He's going to ask for more. But I thought I had clicked it, but I guess I had not. I also really like that video because you can hear the child's voice in the background, right? So this is a great example of how we can use AAC even for a child that is verbal. We're working on what doing questions, which is like, what is so-and-so doing? Or what are you doing? And understanding what that means and being able to answer it. So it was really great to be able to model on that device drinking, because he had said juice, right? So then I was able to expand, what is he doing? Drinking juice. And then we could hear him verbally say, answer that question, right? So he's getting that, the model visually, auditorily, and so it's neat to see that in action. So the next here is expressive language. So let's say we've modeled. Now we want our child to also utilize. So you can go ahead to the next slide. So different ways we can integrate our device is having your child talk about what they're playing with, just labeling. Let's say you're playing with colors. This is blue, this is green. Or in this situation, playing with animals. This is a dog. Greetings, saying hi or bye, or asking or objecting for items. So let's say, I always kind of I tell my parents often, I'm sorry, but I'm going to create a terrible twos. That is my goal. My goal is to get your child to say no, 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 no. And the reason is because if we don't give a child a functional, appropriate way to be able to say no, what are we going to see? We're going to see hitting, we're going to see spitting, we're going to be throwing, they're going to be screaming, right? Because if we're in a situation where we're feeling uncomfortable, or we don't like what's happening, and we didn't have a way to say no, thank you, or please stop. Oh, you bet we would find a way to tell people, please stop, right? So my goal is to be able to teach a child to say no, 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 and then we can say, I hear that you don't want to do something, but we got to do it anyways, right? And so then that's a whole nother level of learning that we can go into. So this is a video of being able to use our device to greet. Oh, can you pause it real quick, Jackie? I want to say something super quick. I'm sorry. I also really like this video because you'll see me shift. We were getting this video to practice requesting, okay? But our little friend is more interested in the individual that is recording. So I was reading her body language and saying, okay, she does not want to play with Mr. Potato Head right now. We need to shift and focus on helping her greet the new individual that came into our room. So.
Oh, it's not going to work like this.
And you have to go out and come back in. Or if you go to the last slide and then come back to this slide, and it'll pop back up.
Yeah.
Oh. You can play it on this computer if it doesn't go.
That's weird. Shows it there.
Where did you see it somewhere?
Well, when you initially got on the slide.
I'm going to try again.
Maybe let it load all the way.
Shall I try?
Yeah.
Yeah.
That's this.
Oh.
Do you want me to pull it up on the?
I know, I'm just trying to try all the options. Nothing's working for me. What do you want to do?
I have it. Let's see if it goes on.
You can tell there's no Potato Head playing there.
Right. Those I can sorry for the people in Zoom.
Maybe you could send it.
Yeah. Okay, so. All right.
I can see it, but maybe you can turn it into her so that they
Okay.
can see.
Do you want to say hi to us, Alexis? So it said hello. So she just says, how are you? So she just said good.
I love your headband.
Thank you. Sign.
Aw.
So the thing
We'll
about
try to
that
post
video is that our our little friend, she really understands the social aspect of the device because she would look at it as I was helping her, but then she would look at Alexis or Tat to do that inner communication, right? Like I'm talking here, but I'm talking to you. So that's really cool to see that piece. So that's great to see. And then these are different videos for requesting. So this one here, you can't quite see it, but there are icons. So there's eating and drinking. And then, so yeah, you can go ahead and eat. So I do enjoy utilizing what motivates a child, right? And if it's snack time, or if it's like a nice little treat for a child that's motivating, I like to incorporate that because it's very functional, right? To be able to state, I'm hungry or I want something to eat. So yeah, that was great for him. The one thing that we really need to take into consideration when we are using icons as choice making is that we want to make sure that the child understands what those icons represent. So oftentimes we, for us, it might seem very obvious. There's a person eating, so that's going to symbolize eating, and someone's drinking in this picture, so that is drinking, right? But that doesn't always come so naturally, right? So that's a skill that needs to be taught. And so if we flip those pictures, the question is, are we able to identify that now my eating is over here and now my drinking is over here? So yeah, just something to kind of think about when we're using icons. And then over here, this is a little, this is our vibration plate. Our little friend here, he really loves the vibration plate. And so once again, utilizing what's motivating for a child for communication. And then turn it off. So then also within that, I'm also modeling, right? So I said, okay, I'm going to turn it off. And I modeled off. And then he went and said on. And so then I said, thank you for telling me on. So I was utilizing that also as a modeling opportunity. And now objecting. And so this is a very, very important skill, is to be able to, like I had said, say no or finish or all done. Oh no! Okay.
I don't want to see our sweet girl.
All right, finish. All right, I guess I can pull it up on here again. I don't know why it's not going through. Okay. So I'll show you on here. Sorry guys, but Drew, are you finished? You can tell me right here. All right, finished. All right, we'll do something else. We are finished. And so a big thing is reading body language, reading situations to really see how does a specific child tell me that they're done, right? For this little friend, she goes to her people icons. She goes to any icon that she really feels comfortable with to say that she's done with an activity. So now it's kind of saying, okay, I see that you're done. I see that you're bored. I see you want to move on. Mm-hmm. So let's use this word finished or all done to tell me in a more, effective manner for someone that doesn't know her mannerisms that she's done with something. That is that. Do we have any questions at all? I know I've covered a lot of information. Anything specific to situations, families, or devices? Yeah.
To model like pronouns like I and you, how
Yes.
I confuse myself when I'm trying to model that.
Yes.
How are any good tips for those?
Pronouns are very, very tricky. And I've been practicing for years and I still get tricked on how to effectively utilize those. Turn taking can be really a good way of doing it. So having the device and then, so let's say it's like you're trying to say my turn, right? Which is challenging, right? Because, and then you can say your turn, but then kind of flip over and help your child, my turn, and then your turn. So it is very tricky. You could also do, I'm trying to think, on like, if you are playing with toys, kind of identifying, okay, there's toys over here and I have toys on here. So like I have blue, I have red, and then kind of switch gears and help to say, okay, I have red, I have blue, or whatever colors are in that side. It is so kind of, so you're kind of the one that's switching the roles, if that makes sense.
Okay. Like you're saying physically, like,
Yeah,
so
physically
then they
moving.
can also see that you're moving. Okay.
Mhm, mhm. And then, yeah, and giving that hand over hand
Mhm.
support. Does that make sense?
Yeah.
Okay. But yeah, it's tricky.
Mhm.
And then the child gets confused and you get confused and then you're like, ah. But yeah, it's hard. Do you want to see any, oh, is there a question?
I was just gonna say this is one of the moms of a kiddo who just started using an AAC device that Karina recommended to us. And it wasn't that I was hesitant to begin it because I'd read all of the studies and I knew that there wasn't anything that would that would stop him from verbalizing eventually. But I had been told by his speech-language pathologist at school that she really thought he was just on the verge of being able to use words. And so I kept holding off and I kept holding off and I kept holding off. And I have to say now that we've started using it, we're into it a few months and we're waiting for insurance to approve ours. So we're using a loaner. But my son is so much more verbal now, and his frustration levels when it comes time to want something that he can't verbalize quite yet, he'll actually go and get the AAC device. And if we bring it to him while he's, visibly frustrated, he kind of calms down because then he's able to tell us what he wants, which is really just a revelation for us. So we're really thankful that Karina was really enthusiastically and because I really believe that this will be a bridge for him. So and also it was brought to someone brought to my attention that in the event that he doesn't become verbal in the way that most people are verbal in terms of communication, if as an adult he doesn't have some means to communicate, we all hope that our kiddos are going to be verbal and be able to communicate all of their needs and wants. But if he's not got that, and we're not there to translate for him with other folks that don't know who he is, then that's going to be a really big problem for him. So having a means by which he can use to communicate to other people that they can understand is so important. So while we're hoping this is really a bridge to becoming more verbal, and we're seeing really positive effects from that, really we don't want to close off any avenue for him to communicate. So if any of you are kind of on the fence and thinking about it, all I can say is that there's only good things that come from this. So I really am really grateful to Karina for advocating for this, because we would have dragged our feet, and quite frankly, nobody else has suggested it to us. So I don't know that we ever would have kind of hit on this for a while. So we're really thankful. So anyway, just wanted to give 2 cents.
Thank you. Yeah, it's really neat to see children be able to progress in that communication piece and become more verbal in the as it goes on. So
So the lifespan of the device, and then how often are they eligible to be renewed, or I guess replaced?
Yeah,
Exactly.
replaced.
Kathy.
Yeah, so that is a really good question.
I can tell you the
Can you,
Toby.
yeah, tell us what the Toby.
So with the Toby, we were told that the lifespan of it should be like, I want to say they said like it's like 2 to 5 years, because basically what it is a computer with an Aac system on it. So it's just like having a computer. So it's kind of like that. But that's what they told us. I think we can, I think it's every 5 years, we could get a new device, whether it's the Toby or let's say we decide to try a PRC or whatever change. But I think it's around 5 years.
Sure.
Can I also add, we opted to not go through insurance and we went through the school system. And we read through them, so then any updates or if they completely like, die off or whatever, they will replace it. Drew has already broken one and they replaced it the same day. So it's kind of nice to go through them and not have to like file an insurance claim. So just for food for thought for like other parents.
Yeah.
And
That's a
we,
really good question.
and we keep it as long as she's in the school system, like throughout the summer. Like I have it now, she's asleep. I didn't like steal her voice or anything.
No, my daughter's not asleep. I stole her.
Yeah. No,
I
that's
think- I think-
good. Thank you for sharing. That is another avenue that can be gone.
And like you said, you're born from Easter Seals, you can go in the Easter Seals library
Yes.
and rent.
Yes.
And they're so good. Like if there's not somebody
That's
else that wants it, like you
Yeah.
can just keep renewing
Yeah.
it.
Yeah.
Yeah.
I think
Go ahead, sorry.
I think the positive though for going through insurance is that if you ever leave your school district, you have to leave the device behind. It actually
Yeah,
belongs
right.
to the school district. So if you are intending on staying here forever and know you're never going to leave the school district ever, it's absolutely great way to go. But if you're not sure about that, you might want to go the opposite route and go through your insurance.
But they're expensive devices, right?
Yeah, especially the eye gaze. She was sharing the eye gaze.
What's nice is-
shocked.
Like I think our insurance, covered like 80% of it, but then my daughter has Medicaid because she's disabled. So they picked up the 20%. So we literally paid nothing for it. And so it worked out, but not everybody's insurance is the same. So
And-
some deny it.
Lamp is 50% off for the iPad right now, according to
yeah.
Karen. So
Good to know. Yeah, so there are very many different routes that you can go through to get access to devices. The nice thing about getting a speech generating device from a company is that you get the tech system to go with it. So the tech support, it's a little bit more durable instead of like we have an iPad here and we utilize the iPad here at the clinic. So it is definitely an effective method of communication. But the nice thing about a device too is that it'll get increased volume as well. So if you're in like a more noisy area, they have the option for that. So
And I want to say for like the Toby and the PRC, they usually give it to you for like a month to trial it first. So you can usually, before purchasing, because they are such huge purchases, you can set it up so they will allow you to use it for a month, and then you just have to mail it back to them, and then you can do the other one, and then you can decide which one you actually. That's what we did, and we got lucky because we did it out of First Steps, right? We just
yeah,
they caught it, and I didn't realize Ruby was young. She was under 3, and I'm like, oh, we can get this right now. It was like I thought this was like something she could do later in life, and they were like, no. And so that's how we got help setting it up, was through First Steps. But they did let us trial them first because it's expensive.
it's a big step. It's a very big step. But yeah, and then so there's a lot of different ways you can go about trialing. And I can't remember, did you mention Easter Seals?
Yeah, and
That's who it was
Yeah.
through.
she put something in the chat.
Yeah.
Her name's Wendy, I think. She's the augmentative communication person through Easter Skills. She's
And-
the one that you would want to contact.
Yeah,
She's
and I-
very helpful.
Yeah, I've also talked to Scott Carter. He's been really, really helpful in helping me get devices from there as well. So if you need any of that information, let us know.
Question. So one of my biggest issues with the Toby, not the Toby necessarily, but just like eye gaze in general, just devices, is like how often should we be using this? Because the truth is, it's exhausting.
Yeah.
It's a lot of work. And it's not magic,
Yeah.
which you hope it's going to be, but it's not. It's
Yeah.
hard work.
Yes.
Not only for us, but also for my daughter, right? She's using her eyes and she fatigues and everything.
Yes.
So in order for me to not feel guilty as a mom, because there are days, I'm not gonna lie, where the Toby's always in front of her, but like where we don't actively model for her with it. And so my question is like, I was always told just do the best you can. But I mean, like, obviously as much as we can is best. But what would you say appropriately? Like, because I've heard like, oh, just use it during dinner, or even if you just use it for like 10 minutes a day, like that's okay, you know? So I guess I'm just trying to make myself not feel guilty. But
I
just
love
wondering what
all
your
of that
thoughts are.
input that you have heard.
Yes.
That is all very, very good recommendations and all very great input, because yes, devices are challenging. And especially with eye gaze, because you have to set it up, make sure that the eyes are in range, right? Making sure that we're focused in on it. And then making sure that it's in front of her while also trying to get around and model,
You can't sit
right?
behind, you have to sit, because then they picks up your eyes. And
Yes, so it's challenging. So I would say all of that recommendations, yes. I think that maybe set like a little goal for yourself. Say, okay, maybe this week we'll do 10 minutes a day, structured, not structured, because I don't want it to be
Well, I know what
outside
you
of
mean.
your routine.
Like where I'm modeling.
Right,
for
within your
her.
routine, right?
Okay.
Don't make anything outside of your daily routine. You don't need more additional work.
Yeah.
And plus, you want to make sure it's functional, right?
Yeah.
Because when do you want her communicating in her daily routine?
Right.
So maybe you say, okay, as we're whatever is the easiest time of day, whether that's getting tucked in at night, I don't know, or maybe it's getting out of bath, or maybe getting into bath, or whether it's snack time, whatever is the most relaxed, chill time of her routine, go ahead and model it in that, because then she'll feel a little bit more relaxed, you're a little bit more relaxed, and then it can just be, more play than anything.
Yeah, and I'm no speech therapist, but I've raised 3 kids into their adulthood. I would say I would look at doing it when it can be enjoyable, and not feeling bad when it's not going to be enjoyable or productive for everybody. It's that relaxed mentality that Karina talked about.
And
I think would be so
And
valuable.
I think also too, it's probably based on each individual child, right? Like every
Yes.
child is going to be different
Yeah.
with the device.
Tolerance and
My daughter
threshold.
she can't actually get up and walk, but she's constantly moving, so like to do eye gaze is hard sometimes because she's not always in a position where she can use her eyes. So
Exactly.
anyways.
And that's also, I love that you mentioned that again, because eye gaze is so fatiguing. And I don't know if anybody has an opportunity, and if you want to today, try out the eye gaze. It is very fatiguing.
And that
It's hard.
in
I've tried. It's
the-
hard.
In the staff in service that Karina did, that was one of the first things she said, is this is very mentally fatiguing for,
Try to say a sentence. It's not easy.
yeah. Nope.
Well, I was gonna ask too, because Lucas also tried eye gaze.
Mhm.
And we decided that it wasn't for him because he is so like active and it is so hard. So I'm just curious, like, why did you guys decide that was
because-
a good fit for her?
So my daughter has Rett syndrome, so like she regrets, so she's eventually probably not going to be able to use.
Okay, so it's
Her
something
hand.
that'll work.
Yeah, I mean, she's
more and more.
she can still like she mouths a lot and stuff, but like based on her diagnosis, like she won't be verbal. Like she'll never. She may. Okay, check that out. She may have like a word or two. Like right now, she'll say "baby dog," but that's it. She cannot, and then she'll lose that, and then she'll maybe say another word. But she doesn't talk, and she never will based on her diagnosis. So I think just based on her diagnosis overall,
Okay, gotcha.
that's why we kind of are stuck with the idea. It's not that we don't love it.
Something else, like,
No.
for someone who is that active, like, it didn't work for Lucas, but we haven't found anything else.
She
that has
can't,
worked
her
either,
thing is
so.
more like she can't control her body. So like,
Gotcha.
yeah, like she has things she wants to do, but her
Yes.
brain and her muscles don't communicate. So sometimes it has jerky movements. but I don't think there really is honestly a ton else for Ruby, other, she can do some switches and things like that. It's just, she doesn't have a lot of purposeful hand movement, I guess is, yeah. I mean, I don't know, I think because that is
Yeah.
what she's gonna have to use, we want her to
Yeah.
be using this now
Yeah.
so that she can learn
So you
it.
Train,
Yeah.
train for that.
Is that
Yeah,
an okay?
yes.
connection? Okay.
Perfect explanation.
Okay, I just wondered like, how do you rule different devices out?
Mhm.
Because obviously that one takes a lot. I mean, we tried it for quite a while and I mean, I could barely do it. I was like, there's no way Lucas is gonna be able to focus long enough to.
Yeah, yeah.
So obviously we ruled that out, but then you go to other devices and I
Mhm.
mean, he's not to the point yet where he can make choices and things like that. And you work with him, but.
Yeah.
So what's your next step? Like, how do you know? Okay, at what point do you rule out things? Like we've tried the switches, we've tried the squares, the ones,
Yeah,
would you say mid-tech devices,
Yep.
the blue ones?
Yep.
So do you just keep kind of working with the kid until you are like, okay, he's got enough to use this device at this point?
Mhm.
Or do you just kind of, I don't know, how do you make that decision?
Yeah, it's a really great question. I think that it's a lot of trial. It's sounds kind of silly, but trial and error, right? So working on a certain device in terms of, okay, how are we accessing these buttons? Is it easy for him to be able to reach and select? Is that hard for him to get that push? Okay, if that's hard, let's say, for example, with this. So I like this as an example in terms of the difference between okay, so let's say we are at that choice making stage, right? Choice making between a ball tower, pretend, and our vibration point, right? Okay, so to do this, right, we could access it in a couple different methods. We could tap, right? Or we could take off and give, right? So there's different variables on that. However, with icons, we're not getting auditory feedback, right? These are really close together. So it's not making it as much of a differentiation between these two icons, right? If we're going to be grabbing, can the child grab, right? Because that's something working with OT with. And then give, right? So there's a lot of motoric, visual stuff going on right with this, right? So then if we put the icons on here, let's pretend they're a little bit big. Okay, and then we'll have, so if you press it, you hear the auditory feedback, right? So you're still getting that touch, but you're hearing, right? Still a choice of two. But we're still only getting this little blue strip differentiation, right? So the one thing that is nice though about this too is that it's perfectly for that hand, right? But also on this one, you have to put a little bit of pressure, right? So even if you put your hand there, you still have to push down pretty heavy to activate it, okay? So still feel the two, but different activation. Then if we go to the buttons, still feel the two, right? You're getting auditory feedback because you're pressing them and you're hearing, though it's muffled and it's not the great auditory feedback, but it is what it is. You're having the two different icons, but you can separate them as far as you want to really show that full differentiation, right? So kind of even going within two icons, that trial and error is very different, right? Figuring out what works best for a child. And there's some kids where these buttons, they don't work as well as something like this, but sometimes having auditory feedback or having the actual tactile system, that doesn't work well for kids, and they do better with because they need to have the understanding of, if I take this off and giving it, I'm really asking for this item versus just repetitively hitting a device, right? So as you can see, even within two icons, there's so many different ways of, and this isn't even these are just 3 examples, but there's all these different things that we have to fine tune. But then another way that we can do feel the two is on Sounding Board, which is a free app. I don't use it as much as I used to, but just to kind of give another example of even within a field of two, this is different, right? So we have go and stop, right? So we're still getting that activation of a field of two. It's on a device. You don't need as much pressure to activate it, right? But they're close together. There sometimes kids, they respond differently to screen, where it's just, it's a screen. So this isn't communication. This is, so we have to take that into consideration, right? But then we could even go a step further and we could add a switch to this, right? And we could see if they can toggle between the two and then make that selection. So, so there's so many different variables that we're really thinking about. And then we could even go into another. So if we're going to lamp, and then we go to a field of two, we'll take go off, and then I think it was out. Okay, so then on here, if we can get an isolated point, then we could do a want and finish, right? So another field of two. Smaller icons have to have that isolated point or working towards an isolated point. So we have to also take into consideration vision as well. So long story short, there's just a lot of variables to kind of think about what works best. How does a child access it? What's their motor look like? What's their vision look like? What's the cause effect understanding look like? And just really finding not only what works best for the child, but also for family too, right? What does the home environment look like? What does school environment look like? So yeah, long-winded answer. Did that kind of answer your question?
Yeah, kind of, yeah.
Kind of. So yeah. And figuring out what works best, and it can take long. Sometimes it can take a longer time than we hope. We sometimes we wish there was that magic button or that magic switch that, okay, this is it. We got it. And hopefully someday we do have that magic switch but it's come from a lot of trial, a lot of figuring out what works, and also just a lot of practice, a lot of repetition.
Karen and Sarah, do you have any other questions?
No.
Well, thank you everybody for coming. I appreciate your time, and yeah, and if you want any copies of the slides, just let me know.
Thank you.
Bye everyone online.
Bye, thank you.